There things that people should be concerned about, perhaps if they have been on asthma medications for much of their life, as far as being aware of these risks?
Well, I think that the patient should be informed of the risks of having steroid treatment being oral or being inhaled, or even nasal steroids like Nasacort. That these can cause problems over time, and that you want to be aware of these risks. But as I said before, sometimes we can get these patients off of the medications, and sometimes it's just a necessary evil, if you will, that in order to breathe properly, and breathing takes precedence over everything, that we would have to continue that treatment as long as necessary.
Sure. Um, if someone has been on oral steroids, um, should they be keeping in touch with an ophthalmologist?
Well, it depends what the risk is. If someone has been on steroids for 3 to 6 months and it had to be maintained on a period that long, and they're starting to see other side effects from the steroids, like elevated blood sugar and the like, it probably is a good idea to have a baseline check with an ophthalmologist to check for the pressure, to dilate the eyes, to see if there's any cataract formation. Now, we're talking usually in more of the adult population.
Sure.
Children, probably less so. But again, the longer they've been maintained on the steroids, the more the potential for complications exists.
More generally, are there things that parents can do to help manage eye allergies?
Yeah, for eye allergies, the treatments topically are to use antihistamines and mast cell stabilizers, as well as sometimes even a mild steroid to control the really red, itchy eyes. Also, the oral medications like Allegra and Zyrtec will have a positive effect on the symptoms of eye allergies, which is the redness and itching, excuse me, and itching primarily.
Great. Is there any other advice that you would give parents of children with asthma today?
Well, I think we've covered quite a bit. It's being vigilant about their symptoms and getting them treatment when they need it, because it can be a very scary time for a child who's not able to breathe properly. And so, there's great medications out there, and see your doctor, because you don't want to wait too late.
Great. Thanks again for being with us, Dr. Shanbom. If people listening today want to follow up with you, what's the best way to reach you?
Well, my website is ShanbomEyeSpecialist.com, or you could reach me by phone is 248-546-2133.
Great. Thanks again for being with us today.
Thank you.